Yeah,
So
everybody's on Michigan.
we are here now with Tiffany Mahia, who is our current resident, and she's been here for about 7 months, I would say. And so we're gonna ask her a few questions to see, hopefully get you the insider scoop on what it is like to be a resident here. So hold on. Okay, Tiffany, why don't you introduce yourself, and then I'm gonna ask you a few questions. So tell us where you came from first.
Okay, so my name is Tiffany. I am originally from the Phoenix area, but I went to school down in Tucson at the University of Arizona.
Nice. So why is it that you chose to come to Boswell?
So I chose it because I actually had a rotation here, and I really liked the challenges that I came across with the different patients, being on the floor, interacting with the nurses, and also my interactions with the other pharmacists I was able to shadow. Everybody was really welcoming to me as a student. Everybody was really willing to put in their time to teach me, and I think that's really translated over as my experience as a resident too.
Yeah, the staff here, like even with us students that are coming in, seem to, I mean, they're so excited when they see the students. They're like, oh, students are here.
Yes, they're always willing to take students.
It's so fun. Who was your rotation with?
I had my rotation as general medicine with Dr. Christy Russell.
Oh, very nice. Love Christy. She's still on our 2 North neurology. Yeah. She does neurology for us for the residency. Awesome. So tell us a little bit about, now that you've been here, what's your favorite part of this residency?
I think my favorite part is just really the different opportunities that preceptors try to provide for me in either like my knowledge deficits that I let them know about, or just experiences that I really want to be more involved in. And that's in really any of the rotations that I've been in. So, you know, as a student, it can be a little limited just depending on where you're at in your rotations, but as a resident,
especially during COVID.
Yes, especially during COVID. But you know,
which I'm sure you've all experienced.
Yeah, so you're getting the proper PPE. You're able to be with the pharmacist, really show that pharmacy is an essential part in whether you're in the ICU, in the ED, on the floor. You're a pharmacist, so you're able to really make those recommendations, help out with nursing, help out those patients as best as you can with the COVID precautions.
Yeah.
But really just get the experience that you really want out of this.
Awesome. So can you give me an example of what you just mentioned? You said the preceptor gives you the opportunity, like if you wanted a learning experience or something out of that rotation. Can you give me an example of that?
Yeah, so in the ED, like I didn't have as much hands-on experience with like intubation or codes, and so my preceptor was willing to have me be in charge of the medications, handing them to the nurses, being able to kind of handle that code card during a code. And so I think that was really valuable for me to be able to get that experience and then get that feedback from her, you know, on what to improve on and what to do for next time.
Yeah. That sounds pretty awesome. Who is your ED preceptor?
Dr. Michelle McCulley.
And she is still here with us,
yes.
So that is a really fun experience. That's pretty awesome. What would you say you like? I guess that is the question about the preceptors. What was my last question going to be? Maybe.
Oh, to give to the, what was something that all the applicants should know?
So Tiffany, tell us what you would like to, or what you would have liked to have known coming in to this residency. Like, what would you want to know as a resident applicant about this residency?
I think my main message for people who are applying to a residency is just your experience is really what you make of it and the opportunities that you look out for. The preceptors, I think, are really willing to help you out in anything that you feel are lacking in or not confident in, to be able to bring you to that level where you do have that confidence that increases or gain in knowledge that you missed out on maybe on rotations previously. So I really think if you're able to really show that you want to improve or you want to grab a hold of these opportunities, they can try to place them to you as available as possible, especially if you're really like hungry for it and want to have that drive for it.
So it is what you make it.
Yes.
Awesome. All right. Thank you, Tiffany.
Yeah, thank you.